prescription drugs, then I have a question for you. Are you taking the drug or drugs to treat the actual disease that you have, or are you taking the drug to treat your symptom? So before I continue, I want to define what a symptom is. A symptom is a subjective feeling of a disease. So in other words, it is subjective because you're the only one that can feel it. This is in contrast to signs. Signs are objective feelings or measurable data of a disease. So for example, when you feel pain, joint pain, that's a symptom of maybe arthritis. And then if you have, let's say you have asthma and you're wheezing and your breath is shallow, that's a sign. So wheeziness is a sign of asthma. And the same with blood pressure. So when we measure your blood pressure and it's high, it's a sign. This is in contrast to what medical, what we believe that high blood pressure is a disease. It's actually a sign. And so I talk about symptoms and treating the actual diseases because conventional medicine has a way of treating symptoms. So when you go to a doctor and you complain of joint pain, the doctor would prescribe painkillers. But there's a problem with this. When you have a symptom or a sign, it's actually a signal that something isn't right in your body. And so when you suppress the signal, you're actually denying the information you're receiving from your body that something isn't right. And so the problem continues. So when you have joint pain and you suppress the pain with painkillers, the cause of the joint pain continues. It's very similar to let's say your house alarm going off, and then you turn off the alarm without investigating the cause. So your alarm could have been tripped off by a fire, but when you turn off the alarm without actually investigating the cause, the fire continues. So this is very similar to what conventional medicine does, when they treat the symptoms without actually investigating to find out the cause of the disease. So I'll give you an example. If you go to your doctor complaining of joint pain, they're going to give you medications to treat the pain. So you'd either receive painkillers or anti-inflammatories or steroidal drugs. They're all doing the same. They're all there to reduce your pain. But the cause of the joint pain could be varied. So you can have joint pain due to wear and tear or due to nutritional deficiencies. Joint pain could be due to infection. So in our clinic, we'll find a lot of people have joint pain because they've been infected with cytomegalovirus. You could also have joint pain because there's accumulation of toxins in your joints. So from our scan, we find people complaining of joint pain could have high levels of lead, and lead causes brittle bones. So it degenerates the bones and takes the place of calcium, so it displaces calcium. So toxins could also be a cause of joint pain. You could have joint pain because there's restricted blood supply to the joint. You might have atherosclerosis, and because there's less blood supply to the joints, your joints are not receiving nutrients, and this could lead to inflammation, which generates pain. So you could see joint pain could be due to so many causes. But then when you treat it with painkillers, the cause of the joint pain continues until it develops complications. So for example, and the thing is, it's really easy to treat these causes of joint pain. So when you have joint pain due to degeneration, you can easily treat it with MSM, methyl sulfonylurea. This is a natural chemical found in the body that is converted to collagen, and this is what we use every day to treat people suffering from chronic joint pain successfully. When you have infections, like infections due to cytomegalovirus, you can easily treat viral infections with colloidal silver. If the joint pain is caused by toxins, then you have to detox the body to eliminate the toxins and then provide relief for the patient. And if it's due to hardening of the arteries, narrowing of the arteries, atherosclerosis, then you treat it with an enzyme, a natural enzyme called serrapeptase that can dissolve the plaque. So really a lot of the causes of joint pain can be easily treated. But when you take painkillers, you're not really treating the cause of the disease. You're just treating the symptom while the disease continues. And this is what happens for so many and problems that people suffer from. High blood pressure, for example. You might have high blood pressure that is caused by high blood pressure has so many different causes. If you have infection, gastrointestinal infection, for example, that could cause high blood pressure. If your immune system is low, that could give rise to high blood pressure. If your neuroendocrine or hormonal system is dysfunctional, that could give rise to high blood pressure. If you're stressed, that could give rise to high blood pressure. But what you find is when people are suffering from high blood pressure, they are prescribed medications that only reduce the blood pressure without trying to investigate the cause of the high blood pressure. So it's really important that you find out why you're taking your medication. Are you taking your medication to treat your actual illness, or is it treating your symptom? And this is why at MedB Clinic we carry out a full body diagnostic scan to help us find the root cause of diseases rather than just treating the symptoms.